Good evening everyone. Let's continue with your review for MS Nursing Genitourinary Tract naman tayo. Pag-uusapan naman natin ang urinary tract system. Number 1. An example of an upper urinary tract infection is, what is your answer? Is letter A. Acute pyelonephritis. Okay? This is the ratio. Ang upper urinary tract natin is composed of your pyelonephritis that is inside the kidneys and of course your ureteritis, which is the inflammation of the ureters. Ang ating lower urinary tract naman kapag nasa part na siya ng bladder. So anything below the bladder is actually your lower urinary tract infection. You have your cystitis and urethritis. So your answer here is letter A, acute pyelonephritis. Cystitis, prostatitis, and urethritis are all examples of your lower urinary tract infection. Number 1 is letter A. Okay? Next number, a sign of possible UTI is, isa-isahin natin. A negative urine culture. Kailan magiging positive ang UTI? Dapat positive ang urine culture niya for bacteria. B, an output of 200 to 900 ml with each voiding. With each voiding, maganda nga ito This is a good way for you to prevent UTI. Between letter C and letter D, what's your correct answer? Pareho kasing abnormal. Parehong abnormal si cloudy urine at yung kanyang urine-specific gravity. However, ang pinaka-sign or ang isa sa mga pinaka-indicative ng sign ng infection is actually your cloudy urine. Okay? Urine-specific gravity kasi natin shows a person kung overhydrated ba siya or dehydrated. Ang normal kasi nating urine-specific gravity is your 1.010 to 1.030. So kapag less than 110 ang kanyang urine-specific gravity, it is overhydration. Less than 1.010. Kapag more than 1.030 naman ang kanyang urine-specific gravity, that is dehydration. However, ang tinatanong kasi natin dito is your possible cause of your or possible sign ng ating UTI is your cloudy urine. Number 2 is letter C. Number 3, the most common site of a lower UTI is the, What is the common site of our lower UTI? Okay, aalisin na natin si kidneys kasi napag-usapan natin kanina, di ba? Na the kidney is an upper UTI or upper urinary tract infection. So, among bladder, prostate, or the urethra, ang pinaka-common dyan is your bladder. Bakit bladder? It is because sa bladder, urine stays in the bladder. And we know, di ba, na urine stasis can cause your UTI. Okay, saan ba tumatambay si urine? Sa bladder. So, most probably, baka sa bladder ang most common site of UTI. Number 3 is letter A. 4. There is an increased risk of UTIs in the presence of, increased risk ka daw na magkaroon ng UTI if, isa-isahin natin, altered metabolic status sa mga patient nating may diabetes mellitus, it increases the risk for UTI. Immunosuppression as well, mababa ang kanilang WBC. Pag mababang WBC, meaning mas madali kang makamtan ng infections, it also increases your risk for developing UTI. Urethral mucosa abrasion, may sugat yung urethra mo. The more na makakapasok ang infection sa urethra mo, it increases your UTI risk. So technically, your answer is iota. All of the above. Okay, number 4 is letter D. Next, the most common organism responsible for UTI in women and the elderly is, ano pinaka-common? It's your E. coli. Bakit? 'Di ba? Generally din, ang usually na naaafektan ng ating UTI is actually women because of the distance between your vagina and your anus. 'Di ba? Halos magkalapit lang kasi yung vagina and anus ng isang babae. Tapos, ano pang isang pinaka risk factor kung bakit babae ang usually nagkaka-UTI? They have shorter urethra. 'Di ba? Mas shorter yung urethra, mas malapit yung ita-travel lang ng bacteria to infect your upper upper urinary tract or your urinary tract itself. Okay? Ano bang main reason bakit tayo nagkakaroon ng E. coli infection nagkakaroon tayo ng UTI due to E. coli infection? It is because of your improper wiping. Paano ba dapat magpunas after umihi, ladies? Front to back or back to front? It should always be front to back. Dapat yung pagpunas natin, mauna muna dun sa vagina palikod ang pagpunas. Kasi kung babaliktarin natin, kung sa baba ka nagpunas pataas, there's a tendency kasi na makuha mo yung E. coli or makakuha ka ng bits ng E. coli from dun sa anal orifice mo, pinapasok mo doon sa urethral meatus mo. Okay? So, another board exam question tip, ang pagpunas dapat natin to prevent UTI is your front to back. Dapat maunang punasan yung vagina before yung sa malapit sa may anal orifice. Okay? It's E. coli. It's because of the nearness to the vaginal meatus. Number 5 is letter B. 6. A first-line fluoroquinolone antibacterial agent for UTI that has been found to be significantly effective is, what's our fluoroquinolone dyan? Ang fluoroquinolone dyan natin dyan is your ciprofloxacin. Ciprofloxacin ang ginagamit natin as a first-line treatment for UTI. Cipro. 6 is letter B. Next, frequently, a urinary analgesic is prescribed for relief of burning pain and other symptoms of UTI. Naging board exam question actually namin to. Dalawang question ang tinanong regarding your pyridium or your phenazopyridine. Okay? Your pyridium or your phenazopyridine. Ang phenazopyridine natin or pyridium, it is a urinary tract analgesic. Always remember ha, analgesic lang siya. It does not cure UTI pero it decreases pain due to your urinary tract infections. Okay? Ang side effect ng ating phenazopyridine is actually your orange urine. Yang dalawang yan yung naging question namin before sa board exams. Si phenazopyridine. Orange urine. Number 7 is letter C. Always remember ha, analgesic lang siya ng urinary tract. It does not cure UTI. It only lowers your pain it only lowers your pain. Number 7 is letter C. 8. UTI is the most common site of nosocomial infection, particularly with urinary catheterization. It can be reduced significantly through ang ating nosocomial infection that is called your hospital acquired infection. And among the biggest causes ng ating hospital-acquired infection is your urinary catheterization kasi improper ang ating placement or improper ang ating insertion ng ating urinary catheters. Kasi 'di ba kapag naglalagay tayo ng urinary catheter, dapat sterile technique. 'Di ba? Stress na stress pa nga kayo ng nursing school diyan, 'di ba? Kasi dapat yung left hand unsterile, right hand sterile, mga ganyan, napakadami niyang steps. Okay? Now, for us to fully reduce the chances of UTI, dapat ang ginagamit nating urinary catheter or ang ginagamit natin na urinary catheter system is your closed system drainage. Ang meaning lang kaya siya closed system drainage, walang way para makapasok ang bacteria doon sa inyong urinary catheter kasi closed system ka. Okay? That is your closed system drainage. Ang meaning lang yan, walang makakapasok na bacteria, kaya siya closed. Okay, this is an example of your closed urinary drainage. Pero actually, halos lahat naman nasa hospitals natin, gumagamit na tayo ng closed urinary drainage. Okay, that's your closed urinary drainage. 9. KJ has an indwelling urinary catheter and she is suspected of having UTI. How should you collect a urine specimen for culture and sensitivity? Isa-isahin natin. Letter A. Clamp tubing for 60 minutes and insert a sterile needle into the tubing above the clamp to aspirate the urine. Tama na sana si letter A. Pero, hindi kasi tayo sa tubing kumukuha. Diba? Hindi natin pinapuncture, yung tubing. Hindi natin tinutusok yung tubing, diba? Clamp natin yung tubing. Tapos, i-release lang natin yung urine bag. Tapos, doon na tayo kumukuha ng urine. Hindi natin tinutusok directly yung tubing. Kapag tinusok kasi natin directly yung tubing, edi masisira yung urinary catheter. Next, drain urine from the drainage bag. That is a big no-no. Pag nasa drainage bag na kasi yan, di ba, stagnant na yan, pwede kasing mag-reproduce ang bacteria. So, hindi natin siya kinukuha from the drainage bag. Kinukuha natin siya directly from dun sa urine ng pasyente. Para din tayong kumukuha ng first morning urine. Okay? Next, disconnect the tubing from the urinary catheter and let urine flow into a sterile container. Okay yan. D. Wipe the self-sealing aspiration port with antiseptic solution and aspirate urine with a sterile needler. Mas sterile kasi si letter D compared kay letter C. Always remember ha, kapag culture and sensitivity ang kinukuha natin, this always has to be sterile. Kasi ang kinukuha natin dyan, di ba, is we are trying to find out kung meron tayong bacterial infection. Kapag hindi sterile ang pagkakakuha mo ng ating culture and sensitivity specimen natin, hindi magiging accurate yung results natin. Kaya it's always dapat sterile. Sterile, tapos pinunasan mo pa yung aspiration port mo ng antiseptic solution, napaka-sterile yan. Okay, number 9 is letter D. Okay, that is your urinary catheter. 10. The nurse recognizes that the most common causative organism in pyelonephritis is hindi yan nag-iiba, it's always your E. coli. E. coli talaga ang nagkakos ng number 1 cause ng ating mga UTI. Okay, number 10 is letter A. 11. Acute glomerulonephritis refers to a group of kidney disease in which there is a... Na-explain ko na to, tama? Na-explain na natin to before. Yung acute glomerulonephritis, nangyayari yan because of your antibody reaction to streptococci that results in circulating molecular complexes. Ano yung molecular complex ulit na pinagsasabi ko kanina? Pinagsasabi ko kanina, that is your antigen-antibody complex. Okay? It is also inflammatory in nature from the word itself, itis. Diba? Itis means inflammation. So, this is positive. Tapos positive, diba na-discuss ko naman na sa inyo yung antigen-antibody reaction na acute glomerulonephritis. And then finally, it is your cellular complexes that lodge in the glomeruli and injure the kidney. Yan yung sinasabi ko na antigen-antibody complex. So, your answer technically is your all of the above or a combination of all of the above. 11 is letter D. Okay, next. 12. In most cases, the major stimulus to acute glomerulonephritis is your GABS infection. Okay, si GABS infection din ang nagkakos ng glomerulonephritis. Saan pa natin makikita si GABS infection? Makikita din natin siya kay RHD. Tama ba? Rheumatic heart disease, RHD. Your rheumatic heart disease. Halos pareho lang sila ng stimulus kung bakit nagkakaroon ng RHD at glomerulonephritis. It is because of your GABS infection or your group A beta hemolytic streptococcus pneumoniae. Bacteria. Number 12 is letter B. 13. Laboratory findings consistent with acute glomerulonephritis include all of the following except. Alin daw dito ang hindi natin makikita with acute glomerulonephritis? It's your polyuria. Bakit? Anong makikita natin kapag ang kidneys ng patient natin damaged? Anong mangyayari? Hindi siya makakaihi or makakaihi siya. 'Di ba? Dapat oliguria sana for it to be correct. Okay? Oliguria. Kasi nga naman, di ba, hindi damage nga yung kidneys mo. Paano niya mapaprocess ang ihi kapag damage ang kidneys mo? Kaya ang makikita natin for glomerulonephritis is your oliguria, not polyuria. 13 is letter B. 14. Chronic glomerulonephritis is manifested by, it's letter A, it's anemia. Magkakaroon ka ng anemia kapag meron kang glomerulonephritis. Bakit? Kidneys kasi, it is responsible for erythropoiesis. Ano ba ang meaning ng erythropoiesis? It is the formation of blood cells. It is the formation of your blood cells. what triggers the kidneys to create or to stimulate erythropoiesis kapag nagkakaroon na siya ng decreased blood volume. Kapag nararamdaman ni kidneys na, bakit parang ang konti na lang ng dugo ko, that's the time na nagre-release siya ng stimulant that's the time na ini-activate niya ang erythropoiesis para mag-form siya ng blood cells in way to compensate sana with your anemia. Okay? Pero since ang patient natin sira ang kanyang kidneys, hindi niya ma-realize na mababa ang blood volume niya, nagkakaroon sila ng anemia. 14 is letter A. Next, 15. Health information for a female patient diagnosed as having cystitis includes all of the following except ang hinahanap natin so negative. Cleanse around the perineum and urethral meatus from front to back after each bowel movement. Tama ba yan? That is correct. Tama ba nasabi ko sa inyo kanina, dapat front to back ang pagpunas from the vagina going to the anal orifice para hindi natin makuha si E. coli from dun sa anal orifice papunta dun sa vagina. Or doon, vagina kasi female. Next, drink liberal amounts of fluid. Yes, para ma-flush out natin ang bacteria. Shower rather than bathe in a tub, positive din yan. Kasi 'di ba, kapag tayo nagbababad tayo sa bathtub, there is a tendency na pumasok ang infection doon sa puwerta ng babae. Your answer is letter D. Void no more frequently than every 6 hours. Ang sinasabi dyan, wag ka daw umihi ng every 6 hours. 'Di ba? That is already too much. Nagkakaroon ka na ng urine stasis dyan. And urine stasis is one of the risk factors in developing your UTI. Okay? Now, ang pag-ihi kasi dapat is per demand. Per demand kasi ang pag-ihi natin, or if hindi naman siya naiihi per demand, dapat every 3 to 4 hours umiihi siya. Okay? 15 is letter D. Masyado na kasing matagal si 6 hours. Pwede na siyang mag-cause ng urine stasis causing your UTI. 16. Complications of chronic pyelonephritis include what? Anong complications natin ng chronic pyelonephritis? Chronic pyelonephritis can actually cause all of the above. Okay? Nagkakaroon tayo ng end-stage renal disease due to kidney damage. Nagkakaroon tayo ng hypertension due to water retention. Diba ano bang napag-usapan natin kanina? Pag mayroon tayong pyelonephritis, nagkakaroon sila ng oliguria. So, due to water retention, punong-puno ka ng tubig, nai-impede or naiipit natin ang blood vessels, tumataas ang tension sa blood vessels, hypertension. Kidney stone formation due to oliguria. Diba? Hindi makaihi yung pasyente, hindi natin mailabas yung solute sa katawan niya, namumuo, that is your kidney stones. Kaya, all of this is your complications of your chronic pyelonephritis. 16 is letter D. Next, the kidneys have a very important excretory metabolic erythropoietic functions. Any disruptions in the kidney functions can cause disease. As a nurse, it is important for you to understand the rationale behind the treatment regimen used. 17. PL who is in ARF, acute renal failure, is admitted to the nephrology unit. The period of oliguria usually lasts for about 10 days. Which assessment parameter for kidney function will you use during the oliguric phase? Okay? Paano mo masasabi na nasa oliguric phase siya kapag urine output is less than 400 ml per 24 hours? Yan ang difference natin kay oliguria versus kay anuria. Kapag oliguria, more than 100 ml per day ang kanilang ihi, pero less than 400 ml per day. Kapag anuria kasi, less than 100 ml per day ang kanilang ihi. Okay? So, oliguria, ang isa sa ating signs and symptoms dyan is ang kanilang urine output is less than 400 ml per day. Ano bang normal urine output natin? 30 to 60 ml per hour. Kaya kung kukunin mo ang per day niyan, dapat ang normal urine output natin per day, 30 times 24, 720, 60 times 24, times 24, 1,440. So, dapat ang ihi ng So, dapat ang ihi ng pasyente natin, normally per day is 720 ml up to 1440 ml per day para maging normal siya. Number 17 is letter B. Kasi oliguric phase yung tinatanong niya. 18. During the shock phase, what is the effect of renin-aldosterone-angiotensin system on renal function? Now, dapat ngayon alam nyo na kung ano ang RAAS, ha? Okay. Ano ulit ang stimulus natin for the stimulation ng ating RAAS? What stimulates RAAS? It's your hypotension. Hypotension activates your RAAS. Okay? Ina-activate niya ang RAAS. Anong gusto niyang gawin? Gusto niyang i-hold ang water. Gusto niyang i-hold ang water. Holds water to increase blood pressure. Since ang ginagawa ni RAAS nag-hold ng water to increase BP, it should decrease or increase UO. Dapat decreased ang UO. Kasi kapag pinaihi mo ng pinaihi yung pasyente, wala nang tubig yung pasyente, mas lalo siyang magiging hypotensive. Now, dito na tayo magkakatalo. Increased absorption ba ng sodium and water or decreased? It should be increased. Letter D. Okay? I-increase niya absorption ng salt. Bakit? Salt kasi maintains water. 'Di ba? Where sodium goes, water follows. Kaya kapag ni-retain natin ang sodium, nag-i-increase din ang ating water retention. Okay? Kaya kapag na-retain natin ang water, nag-i-increase ang blood pressure ng patient mo. 18 is letter D. Okay? Next, 19. As you are caring for PL who has acute renal failure, one of the collaborative interventions you're expected to do is to start hypertonic glucose with insulin infusion and sodium bicarbonate to treat what? Ang isa kasi sa treatment natin ng hypernatremia actually is hyperkalemia is your insulin. Insulin kasi puts back potassium to the cells. Okay, insulin puts back potassium to the cells. Kaya ginagamit natin ang insulin to treat hyperkalemia. Number 19 is letter A. Ito ang pwede nyong gamitin na mnemonic for you to memorize the treatment for hyperkalemia. Pwede tayong magbigay ng calcium gluconate, beta antagonist or bicarbonate, insulin plus glucose. Yan yung sinasabi ko sa inyo kanina. Palaging magkasama si insulin at glucose, ha? Kasi 'di ba, imagine ang main talaga na indication natin for insulin is for hyperglycemia. Pero ginagamit din kasi natin siya for patients with hyperkalemia. Kaya binibigyan natin sila ng glucose para hindi tayo mag-induce ng hypoglycemia. Now we have your keyexalate, diuretics, and then of course your dialysis. Okay, next, 20. Acute renal failure caused by parenchymal damage to the glomeruli or kidney tubules results in all of the following except. Okay, parenchymal damage to the glomeruli or kidney tubules results in all of the following except. Ano i-cause niya? Except si letter B. Magdi-decrease ang GFR? Yes. May impair ang electrolyte balance? Yes. Magkakaroon ka ng progressive azotemia? Azotemia means increased waste in the blood. So, answer is letter B. Okay? In acute renal failure, usually pag acute renal failure yan, dapat meron kang decreased urine specific gravity. Kasi kung meron kang ARF, you can't concentrate urine. Number 20 is letter B. Next, 21. Oliguria is a clinical sign of ARF that refers to a daily urine output of, nasabi na natin yan, less than 400 ml. 21 is letter C. A fall in CO2 combining power and blood pH indicates what state accompanying renal function. Now, anong nakikita natin? Bumababa daw, ano sabi niya? A fall in CO2. Bumababa daw ang CO2. Tama ba? A fall in CO2 combining power and blood pH indicates what state accompanying renal function. Okay? A fall in CO2 combining power. Okay. Yung blood pH daw ng patient natin, bumababa. Kapag bumababa ang blood pH, nagiging acidic ang blood. Tama? Kasi 'di ba ang normal natin na pH level is ilan? 7.35 to 7.45. Kapag less than is acidic, pag more than is basic. Okay, yung patient daw natin is meron siyang problems with respiratory acidosis. Kasi hindi niya ma-expel ang CO2 kasi decrease ang kanyang CO2 combining power. Pag decrease kasi ang CO2 combining power, meaning hindi mo ma-expel ang CO2. So nagkakaroon ka ng respiratory acidosis. Okay? Sino ang nagko-compensate kapag nagkakaroon ng respiratory acidosis? It is your kidneys. Okay. Since meron siyang compensating factor, ang nangyayari kay kidneys, nagkakos siya ng metabolic alkalosis as a form of compensation. 22 is letter B. Next, 23. Hyperkalemia is a serious electrolyte imbalance that occurs in ARF and results from. Results from tayo, ha? So, ano daw ang nagkakos ng ating hyperkalemia? It's actually iota na naman. All of the above. Okay? Ang protein catabolism kasi, 'di ba? Protein is a type of tissue. And what makes up tissues? Cells. Okay? What's inside cells? Potassium. Kaya kapag nasisira ang protein, nasisira ang tissues, nasisira ang cells, nare-release ang potassium. Electrolyte shifts in response to metabolic acidosis. Metabolic acidosis is due to your potassium pa rin. And nasabi ko na sa inyo kanina, tissue breakdown breaks down cells, releases potassium. All of the above. 23 is letter D. 24. A patient with ARF and negative nitrogen balance is expected to lose about ilan? 24. Naglulose daw ang mga patient nating may ARF. Nagkakaroon daw sila ng weight loss of around 0.5 kilograms per day. That is according to your Cozier and Herb. 24 is letter A. Okay? Yan talaga yan yung nakalagay exactly na nakalagay na value. Okay, next, 25. Fran is hospitalized with a diagnosis of ARF. She had been taking gentamicin sulfate for a pseudomonal infection. 25. The nurse knows that the kidney is susceptible to damage by nephrotoxic antibiotic agents because it functions as a major excretory pathway and receives 25% of cardiac output at rest. Ang sinasabi lang niyan, lahat 25% ng ating cardiac output or 25% ng pinapump ng blood pumupunta sa kidneys. It is because it is in the kidneys that yung kidneys kasi ang nanglilinis ng ating blood. Kaya almost 25% of blood goes to the kidneys. 25 is letter C. Next, the nurse needs to assess for symptoms consistent with pathology secondary to reduced renal blood flow. Symptoms would include what? Symptoms would include all of the above pa rin. Diba sabi dito, reduced daw ang renal blood flow. Kapag reduced ang renal blood flow, magre-reduce din ang glomerular filtration rate. Kasi wala na siyang i-filter kasi nga decreased ang renal blood flow. Kaya magre-reduce talaga. Now, kapag mababa ang oxygenation sa kidneys, anong nangyayari? Nagkakaroon ng kidney damage resulting to your renal ischemia. And of course, kapag mayroon tayong problems with the kidneys, nasisira din yung kanyang kidney tubules. Number 26 is letter D. Okay, next, 27. During the oliguric phase of ARF, Fran's protein intake for her 156-pound body weight should be approximately. Now, kapag nasa oliguric phase kasi tayo, di ba, hino-hold natin ang protein. Binabawasan natin ang protein. Bakit? Di ba, nasabi ko na sa inyo kanina, protein catabolism results to the secretion of potassium. Okay, ayaw natin kasi ang mataas na potassium for patients na nasa oliguric phase kasi hindi nila maiihi ang potassium. Nag-hyperkalemia sila. Now, paano natin kino-compute ang kanilang protein intake? Dapat 1 gram is to 1 kilogram. So, kung kukunin natin kung ilang kilogram siya, di ba? For us to 156 pounds divided by 2.2 kilograms para makuha natin ng kilogram. So, 156 divided by 2.2 is equal to 70. So, 70 grams per 24 hours. 27 is letter B. 28. While evaluating laboratory studies, the nurse expects that Fran's oliguric phase will be marked by all of the following except. Okay? Feeling ko mali yung tanong dito. Okay? Kapag nasa oliguric phase kasi tayo, we hold water, tama? Oliguria, di ba? Pag ang meaning ng oliguria, less than 400 ml per day lang ang iniihi mo. Kaya you hold water plus toxins. Kaya dapat kapag nasa oliguric phase ka, ang BUN mo or ang blood urea nitrogen levels mo is more than 20. Is more than 20 milligrams per deciliter. Kasi ang tinatanong dito, di ba, the nurse expects that Fran's oliguric phase will be marked by all of the following except. Ano daw ang makikita natin except? Okay. Ano ang makikita natin? Wait lang. Mukhang tama naman pala. Okay, try nga natin. Sagutan. Wait lang. So, ang hinahanap natin, all of the following except. Tama. Ang hinahanap natin is except. Ano ang hindi natin makikita? Tama. Ano ang hindi natin makikita kay? Tama ba? Ano ang hindi natin makikita kay patient na nasa oliguric phase? Diba, will be marked by all of the following except. Okay. Ang mga patient natin nasa oliguric phase, dapat more than 20 milligrams per deciliter ang kanilang dapat more than 20 milligrams per deciliter ang kanilang BUN para masabi natin na nasa oliguric phase sila. So meaning naka-except dapat ito. Next, serum creatinine nila. Since 'di ba, creatinine is a toxin, dapat nire-release yan ng katawan. Ang normal creatinine kasi natin is less than 1 milligram per deciliter. So technically, dapat kapag nasa oliguric phase ka, dapat more than 1 milligram per deciliter ka. Kasi nga hindi mo naiihi yung toxins mo, naho-hold mo ang creatinine. So this is also negative. Serum potassium of 6 mg per liter, yes, that's positive. Makikita natin yan for patients na nasa oliguric phase kasi nga hindi nila maiihi ang water. Hindi nila maiihi ang potassium, ang excess potassium. Okay. Urinary volume dapat less than 400. So, this is also negative. So, your answer is letter C. So, ang hinahanap, bali talaga yung question. Dapat Fran's oliguric phase will be marked by, yun lang. Wala dapat to. Mali yung tanong. Okay? Bonus na lang yan. 28 is letter C. Okay? Kasi si letter C lang ang makikita natin for patients na may oliguric, na nasa oliguric phase. Okay? 29. After the diuretic phase, the nurse should recommend ano na dapat? Kapag nasa diuretic phase na, dapat magbigay na tayo ng high protein diet. Okay. Ano ba ang phases natin ng acute kidney injury? Una, mag-oliguric phase siya. Pag nasa oliguric phase, meaning lang nito is nasa disease process pa lang siya. Okay? Tapos magda-diuretic phase yan kapag healed na siya. Kapag cured na siya. Okay? Kapag cured na siya. Okay. During the diuretic phase, kailangan natin ng mataas na protein diet because we need albumin. Albumin holds water. Okay? Para hindi naman sobrang ihi yung pasyente natin, kailangan nila ng high protein diet para may mag-hold pa rin ng water. What happens ba kasi anong nakakatakot kay diuretic phase? Pwede siya mag-cause ng hypovolemic shock. Kaya kailangan natin ng protein para makontrol natin ang progression into hypovolemic shock. 29 is letter B. Next. 30. The nurse expects that the period of recovery to follow a period of oliguria. Nakalagay dito, ang recovery phase natin is several months to 1 year. Okay, that's your letter D. Next. The most common symptom of cancer of the bladder is what? May mga halata nang i-cross out tayo dyan. Di ba nasabi ko sa inyo kanina, basta cancer ang pinag-uusapan natin, hindi sila nag-represent with pain. Usually, meron silang visible, painless hematuria. Okay, nasabi ko na sa inyo, di ba? Basta cancer ang pinag-uusapan natin, least likely na magkaroon sila ng pain as a sign and symptom. It is usually painless talaga. 31 is letter C. Next, the predominant cause of bladder cancer is, nasabi na natin kanina, that is your cigarette, smoking, kasi it is through the urine that they excrete chemicals of cigarette. 32 is letter B. Next, 33. The most effective intravesical agent for transurethral resection or fulguration for bladder cancer is your Basil-Calmette urine or your BCG. Ano ang meaning ng intravesical agent? Okay, ganito ang ginagawa nila. Ang intravesical, ang meaning lang yan, maglalagay sila ng Basil-Calmette guerin or technically, naglalagay sila ng TB bacteria doon sa loob ng bladder. Bakit? Bakit sa tingin ninyo? It's because ina-attract ni BCG kasi ang mga antibodies ng katawan papunta sa bladder. 'Di ba? Ang talino nga nito tuwang-tuwa ako nung binabasa ko 'to. Ina-attract ni BCG yung mga antibodies ng katawan para pumunta sa bladder. Para patayin nila si BCG tapos ma-detect din nila na may bladder cancer doon or may cancer or may unusual growth ng tumor doon. Para habang pinapatay nila si Basil-Calmette guerin doon sa bladder, napapatay na din nila yung bladder cancer or yung tumor na tumutubo doon sa bladder. That is the use of your intravesical agent. Okay? At ang usual ginagamit dyan is your BCG. Letter A. Okay? Next number. 34. The urinary diversion whereby the patient will void from his rectum for the rest of his life is known as? That is your ureterosigmoidostomy. Okay? Ang mangyayari lang dyan, nilagay nila yung ureters papunta sa rectum. Technically, umiihi na siya doon sa kanyang puwet. That's usually ginagawa yan for patients na nag-undergo ng cystectomy or inalis yung kanilang bladder. Okay? Number 34 is letter D. Next, which of the following symptoms is the most common clinical finding associated with bladder cancer? Ano ulit? Basta bladder cancer, basta cancer ang pinag-uusapan natin, wala tayong pain. Ang makikita natin dyan is your painless hematuria. Okay? Umiihi ng dugo yung pasyente pero wala siyang nararamdaman na pain. 35 is letter C. Next, a client is to have cystoscopy to rule out cancer of the bladder. Which of the following would indicate that the client developed a complication after a surgery? Okay? That's your chills. Ang meaning lang kasi niyan, meron ka ng infection. Ang letter A, letter C at letter D, those are expected effects after cystoscopy kasi. Expected effects yan. Okay? Pero hindi natin ina-expect na magkakaroon ng chills ang pasyente after the operation or after the cystoscopy. It is because chills is an indication of infection. 36 is letter B. Next, renal stones can cause one of the most excruciating pain experienced by a patient. As a nurse of BL, which of the following nursing diagnosis will be your priority? 37. BL was brought to the ER for severe left flank pain, nausea, and vomiting. The physician gave a tentative diagnosis of right ureterolithiasis. As the nurse of BL, which of the following nursing diagnosis will be your priority? Anong priority mo dyan? Diba? Nasabi na nga dito, meron ka ng keyword. Ang mga patient daw na may renal stones, they felt excruciating pain. So among all those, ang priority mo pa rin is your acute pain. Okay? It's your acute pain. 37 is letter C. 38. Which of the following is the appropriate intervention for BL who has urolithiasis? Meron daw siyang bato, meron daw siyang kidney stones. Anong gagawin natin? Anong mas maganda? It's to administer opioid analgesics, preferably IV. Ano ba ulit yung sabi ko sa inyo kanina? Basta mga kidney stones, they feel excruciating pain. Priority ba natin ng pain? Yes. Okay? 38 is letter B. 39. You are caring for YA, 30-year-old businesswoman with renal stones. Her skin and mucous membrane are dry and her 24-hour I&O reveal an oral intake of 900 ml and urinary output of 700 ml. Tapos dark amber na yung urine niya. Halos same lang dun sa question natin kanina. Okay? Kapag yung patient mo, nakita mo, tuyong-tuyo yung skin niya, tapos ang konti lang ng iniinom niyang tubig, tapos sobrang concentrated ng urine niya, anong pwede mong i-deduce? Dehydrated yung patient mo. Fluid volume deficit. 39 is letter B. Next, 40. You are caring for WE, a 56-year-old man who is dehydrated and with urinary incontinence. Upon physical exam, you noted perineal excoriation. What will be your priority intervention? Now, ang mga patient kasi nating may urinary incontinence, 'di ba? Hindi nila mapigilan yung kanilang ihi. Naiihi sila involuntarily. Involuntary urination. Okay, anong kalaban natin kapag palaging moist ang surrounding? 'Di ba? Kapag palaging moist ang surrounding, especially sa skin, 'di ba? It is easy to have your skin breakdown. Moist environment can cause skin breakdown. Okay? Para ma-prevent natin ang perineal excoriation or technically your perineal breakdown, kailangan dry and clean ang kanilang perineal area. Number 40 is letter D. Keep the perineal area clean and dry. Okay, 41. BN, 40-year-old, is diagnosed with CRF. AVF was created for hemodialysis in his left arm. What diet instructions will you need to reinforce prior to his discharge? Ang mga patient ba natin na may chronic renal failure or mga chronic kidney disease or CKD natin, pwede ba silang uminom ng plenty of water? No. 'Di ba meron nga lang silang limited amount of water, usually mga 1,000 ml lang ang iniinom dapat nila per day. Kasi kapag nasobrahan nila, pwede silang mag-congest. Kasi nga 'di ba hindi sila makaihi. Next, restrict your salt intake, that is positive. Bakit ayaw natin ng salt? It is because sodium is a toxin in the body. So, hindi nila kayang i-release ang salt kasi hindi sila makaihi. Monitor your fruit intake and eat plenty of bananas. Ayaw natin ng plenty of bananas kasi mataas siya sa potassium. Okay? Ano ulit ang problema natin kay CRF? Hindi siya makaihi, hindi niya kayang i-excrete ang electrolytes mo. Pwede kang mag-cause ng hyperkalemia. Letter B, be sure to eat meat every meal. Ano nasabi natin kanina na mataas sa meat? Protein. Anong mataas sa protein? Potassium. So your answer is letter B. Ayaw natin ng potassium, ayaw natin ng sodium. Hindi kasi yan kayang i-excrete ng pasyente natin. Pwede tayong mag-cause ng electrolyte imbalances. 41 is letter B. Next, 42. BN is also advised not to use salt substitute in the diet because, now, di ba nasabi natin kanina na hindi maganda sana ang sodium para sa pasyente nating may chronic kidney disease. Pero, hindi din maganda ang ating mga salt substitute. Kasi, salt substitute is, ang contents ng salt substitute is, ang content na ating salt substitute is potassium. Potassium naman ang pangpaalat ng ating salt substitute. So, hindi din pwede. Kasi di ba ayaw natin ang sodium, ayaw din natin ang potassium. So, 42 is letter A. Ayaw natin ng salt substitute because it can cause your arrhythmias due to hyperkalemia. 42 is letter A. 43. A major clinical manifestation of renal stones is what? Anong nasabi natin kanina? Basta renal stones ang pinag-uusapan natin, they have excruciating pain. 43 is letter D. Next, si Rudy daw is for hemodialysis. Yan. Which of the following action would be of highest priority with regards to the external shunt? Anong pinaka-important dyan? 44 is letter A. Avoid BP or blood sample from the arm with the shunt because it can cause AV shunt damage. Diba? Kung na-try nyo mag-duty sa medical ward, yung mga patient natin na for hemodialysis, may nakalagay doon sa kanilang likod or may nakalagay doon sa bed nila na parang save left arm or do not BP on left arm, mga ganon. Kasi meron silang AV shunt or meron silang AV fistula doon. Okay? Kapag nag-BP kasi tayo or kumuha tayo ng blood sample over the area na may shunt, pwede kasi yan mag-cause ng, it can cause your vessel damage tapos masisira yung kanilang AV shunt. Okay? Yan. Letter A. 44 is letter A. Bawal mag-BP, bawal kumuha ng blood sample over the area na may AV shunt. 44 is letter A. 45. Diet therapy for Rudy who has acute renal failure is low protein, low potassium, and low sodium. The nutrition instructions should include what? Okay? We need recommend protein of high biologic value like eggs, poultry, and lean meat. Okay? Ano ba tong high biologic value? Pag sinabi nating high biologic value, complete ang kanyang amino acids. Okay. Now, 'di ba? Ang mga patient kasi natin na may renal failure, meron silang low protein. Low protein ang kanilang diet dapat. So, dapat mag-recommend na tayo na kumain sila ng protein na may high biologic value or kompleto yung amino acids para sulit yung kinakain nilang protein. Compared naman kung kakain sila ng low biologic value, meaning hindi maganda or hindi kompleto yung amino acids na nakukuha nila. Okay? 45 is letter A. Bakit ayaw natin ng raw cucumber, carrot, cabbage at tomatoes? Mataas kasi ito sa potassium. Ang canned foods naman, mataas naman to sa sodium. Fresh fruits ulit, mataas yan sa potassium. 45 is letter A. 46. Rudy undergoes hemodialysis for the first time and was scared of disequilibrium syndrome. He asked you how this can be prevented. Now, ano ulit yung sinabi natin about disequilibrium syndrome? Nangyayari ang disequilibrium syndrome due to rapid removal of water and waste. Okay? It happens because of due to rapid removal of water and waste. Imagine kasi, 'di ba, during hemodialysis, anong ginagawa natin? Kinukuha natin yung dugo ng pasyente, nilalagay natin sa dialyzer para malinisan from toxins and wastes. So kapag masyadong mabilis or masyadong madami yung kinuha mong blood from doon sa pasyente papunta doon sa hemodialysis machine, anong pwedeng mangyari? Disequilibrium syndrome, para siyang nagsha-shock. Shock-like symptom. So, for us to prevent this, dapat initial hemodialysis shall be done for 30 minutes only as not to rapidly remove the waste from the blood than from the brain. 46 is letter C. 47. You are assisted by a nursing aide with the care of a client with renal failure. Which delegated function to the aide would you particularly check? Ano daw ang dapat mong bantayan kapag may nursing assistant kayo sa kidney floor or sa renal floor? It's the monitoring of your intake and output. Okay? Napaka-importante kasi na mag-monitor ng input and output sa renal floor. Okay? Ito kasi ang pinaka crucial assessment natin for patients with renal disease. Okay? So, dapat binabantayan natin sila, minomonitor natin sila sa pag-record nila ng I&O. Dapat sure tayo na tama yung pag-record nila ng I&O. Kasi yan ang isa sa mga pinaka-crucial na assessment natin kapag mga renal disorders. 47 is letter A. A renal failure patient was ordered for creatinine clearance. Ang creatinine clearance test natin, ang kinukuha natin is your 24-hour urine specimen. Tapos, kumukuha din sila ng dalawang separate na blood samples in between. Okay, your answer for number 48 is letter C. Next, Edward, a 29-year-old diabetic patient, chose continuous ambulatory peritoneal dialysis as a way of managing his end-stage renal disease. Yung patient daw natin naka-peritoneal dialysis. Edward chose CAPD because it helped him what? It's all of the above. Okay? Kapag kasi naka-peritoneal dialysis sila, hindi sila masyadong kailangan ng dietary restrictions because continuous ang kanilang dialysis. Okay? So, technically, kahit kain lang sila ng kahit ano, okay lang. Kasi meron sila or bit nila yung peritoneal dialysis nila. Nakokontrol lang blood pressure? Yes, kaya nga tayo nagda-dialysis to decrease your water. Okay? Have control over his daily activities. Kapag kasi, from the word itself, ambulatory peritoneal dialysis, nakakapaglakad-lakad, nakakapagtrabaho yung patient natin habang nagda-dialysis. So, number 49 is letter D. 50. Using CAPD, Edward needs to dialyze himself approximately 4 to 5 times a day with no night changes. Ang meaning lang yan, kailangan niyang palitan yung kanyang peritoneal dialysis 4 to 5 times a day, pero sa gabi hindi niya kailangang palitan. Bakit? Hindi naman siya kumakain during sleeping time. No food during sleep. Kaya hindi niya kailangan ng night changes. Pero, yan lang naman ang isa sa downside ng ating peritoneal dialysis kasi kailangan nilang palitan yung peritoneal fluid for 4 to 5 times every day. Okay, yun lang ang magiging disadvantage niya. Pero compared kay hemodialysis na once every 3 days lang silang nagpapahemodialysis. 50 is letter A. Next, Edward needs to be aware that toxic wastes are exchanged during equilibration or dwell time, which usually lasts for 10 to 15 minutes. Wala nang masyadong ratio yan, book-based yan. 10 to 15 minutes daw ang ang toxic waste removal during the dwell time. 51 is letter A. Next, ano ang pinaka-most common na complication ng ating CAPD or ating peritoneal dialysis? It is your peritonitis. Okay? It is due to your open wound. Okay? Diba? Meron kasi silang incision doon sa ating peritoneum. Kaya ang isa sa pinaka-nakakatakot dyan is ang peritonitis. Ano ating sign and symptom ng peritonitis? Your rigid board-like abdomen. 52 is letter D. Next, Edward's diet should be modified to be ano dapat ang diet modification ni Edward? Dapat low fiber diet. Okay? Kapag high fiber kasi, 'di ba? Nasabi ko sa inyo before, kapag mataas ang fiber na stimulate ng peristalsis. Kapag na-stimulate ang peristalsis, 'di ba? May nakalagay na peritoneal catheter doon sa tiyan ng pasyente mo. Kapag yung patient natin galaw yung tiyan niya, pwedeng ma-damage ang peritoneal catheter. Number 53 is letter D. 54. Fe is experiencing left sharp pain and occasional hematuria. She was advised to undergo IVP by her physician. Mag-intravenous pyelogram. Fe was so anxious about the procedure and particularly expressed her low pain threshold. Nursing health instruction will include letter A. Assure the client that the pain is associated with the warm sensation during the administration of the HIPAC by IV. Hindi kasi natin pwedeng sabihin na the procedure will be painless kasi meron talaga siyang mafe-feel na a little bit of pain. Okay? Kapag tayo nakikipag-usap sa pasyente nating takot, dapat sabihin pa rin natin yung factual informations. Hindi dapat tayo nagsisinungaling para lang ma-relieve yung anxiety nila. Okay? Yan, number 54 is letter A. Ang mararamdaman nilang naman na pain is during IV kapag pinupush na nila yung pyelogram. Okay? That's the time lang na magiging masakit siya. Pero the rest, mag-x-ray lang naman na sila so hindi masakit. 54 is letter A. 55. What will the nurse monitor and instruct the client and significant others post-IVP after the intravenous pyelogram? Anong dapat nating gawin? Or anong dapat nating i-monitor? It is your delayed allergic reaction. Kasi diba kapag intravenous pyelogram, gumagamit sila ng dye. Usually, ang component niya is iodine. Madami daw kasing allergic kay iodine. Kaya nga, di ba, before doing your intravenous pyelogram, ano dapat ang tinatanong natin? We are asking for allergies of shellfish or seafood. Okay? Number 55 is letter A. Baka magkaroon siya ng delayed allergic reaction. 56. Post-intravenous pyelogram, Fe should excrete the contrast medium. You instructed the family to include more vegetables in the diet and ano pa? Kailangan ma-increase ang fluid intake para ma-excrete niya ang excrete medium through urine. 56 is letter A. 57. The IVP reveals that Fe has a small renal calculus that can be passed out spontaneously to increase the chance of passing the stones. You instructed her to force fluids and do which of the following? Ano sa tingin niyo? It is to ambulate more. We stimulate muscle contraction. Nasabi ko na sa inyo before, di ba? Bladder is a muscle. Kaya kapag ikaw galaw ka ng galaw, mapapansin mo ihi ka din ng ihi. It is because of your muscle contractions. Okay? Para ma-aid lang natin yung pag-pass niya nung calculus, palakad-lakarin natin siya para maiihi niya yung stones. 57 is letter B. 58. The presence of calculi in the urinary tract is called. Kapag ang calculi nasa urinary tract, that is called your ureterolithiasis. Kapag ang stone nasa gallbladder, cholelithiasis. Kapag ang stones nasa kidneys, that's your nephrolithiasis. Choledocholithiasis naman, ang stones nasa common bile duct. 58 is letter C. Next, Mr. Santos is to undergo cystoscopy due to multiple problems like scanty urination, hematuria, and dysuria. You are the nurse in charge of Mr. Santos. When asked, what are the organs to be examined during cystoscopy, you will enumerate as follows. Anong chinecheck natin during cystoscopy? Umaabot tayo up until what? Up until the urethra, the bladder wall, the trigone, and the ureteral opening. 59 is letter B. Up until sa ureters, kaya natin ma-examine sa cystoscopy. Okay? Ito yung sinasabi nating trigone. Okay? That's your trigone. 60. In the OR, you will position Mr. Santos his first cystoscopy in. Ang mga patient natin na mag-undergo ng cystoscopy, naka-lithotomy position. Okay? It's your lithotomy position. Ang cystoscopy kasi, pinapasok natin yung cystoscope through their vagina or through their penile meatus. So, dapat naka-lithotomy position sila para mas maa-access natin yung kanilang genitals. Okay, that's your cystoscopy. Next, after cystoscopy, Mr. Santos asks you to explain why there is no incision of any kind. It is because cystoscopy is an endoscopic procedure of the urinary tract. Okay, that is your letter D. Endoscopic procedure meaning pumasok siya sa opening ng katawan mismo. Kaya hindi na natin kailangan ng incision. Kasi dumaan siya through the urethral or urinary meatus. So, kaya hindi natin kailangan ng incision. Next, 62. Within 24 to 48 hours of cystoscopy, it is normal for you to observe one of the following. Normal lang ang ating pink tinge sputum for the first 24 to 48 hours. Kasi nga naman nagpasok ka ng cystoscope doon sa urethral meatus, pwede kang masugat yung kanyang urethral meatus. Kaya normal ang pink tinge sputum. Minimal bleeding. Normal yan. Lahat na to, complications na yan. Hindi yan dapat expected. 62 is letter A. 63. Leg cramps are not uncommon post-cystoscopy. Nursing intervention includes, anong usually ginagawa natin kapag tayo nagkaka-cramps? Anong ginagawa natin usually? Hot seats, bath. Or di ba parang nagpapasona? Parang ganun. Technically, ang hot seats bath kasi, di ba binababad natin yung nagka-cramps nating legs sa mainit na tubig para mag-relax yung muscles. 63 is letter D. Next, preoperative management for a patient who is to undergo kidney transplantation includes all of the above. Una, bringing the metabolic state to as normal as a level as possible. Never tayong nag-OR na hindi stable ang pasyente. Kaya positive ito, dapat stable ang patient. Never na OR ang pasyente pag unstable. B, making certain that the patient is free of infection, of course. Kapag yan may infection, inoperahan mo, there is a tendency na mag-cause ka ng systemic infection. Suppressing immunologic defense mechanism, na pag-usapan na natin yan to prevent your transplant. Rejection. Number 64 is letter D, all of the above. Post-operative management for a recipient of a transplanted kidney includes aseptic technique to avoid infection. Bakit? Kasi di ba naka-immunosuppressant sila. Hourly urinary output measurement to estimate the degree of kidney function? Yes, para lang ma-make sure natin na gumagana yung na-transplant na kidneys. Protective isolation, of course, pareho lang siya kay letter E. Your answer is iota. All of the above. 65 is letter D. Next, you are assigned to take care of 4 patients with different conditions. Na-answeran na natin to kanina. It's the same, di ba? Gumagamit tayo ng azathioprine, cyclosporine at prednisone 2 for the rest of your life to prevent your transplant rejection. Na-answeran na natin to kanina. Naulit lang pala. Next, after the kidney transplant, ano ulit? Fever and weight gain due to inflammation and water retention. Next, FB, 28-year-old with chronic renal disease, plans to receive a kidney transplant. Recently, FB was told by his physician that he was a poor candidate for transplant because of his HPN and DM. Now, FB tells you, I want to go off dialysis. I'd rather not live than to be in this treatment for the rest of my life. How would you respond? Letter D. Take a seat next to him. That is your presence. Sit quietly. That is known as your therapeutic silence. Silence. Ito kasi they encourage verbalization. You never leave the patient, ha? You never leave the patient. Number 68 is letter D. 69. DS signed a consent form. Na-answeran na natin din to ata. Ay, hindi pa ba? Na-answeran na natin to, tama? DS signed a consent form for participation in a clinical trial for implantable cardioverter. Which statement by DS indicates that the need for further teaching before true informed consent can be obtained. Kailan ka daw hindi pwedeng kumuha ng informed consent? Kapag yung patient mo meron pang mga questions. Okay? Kapag yung patient mo may questions pa, hindi ka pwedeng kumuha ng consent. Dapat masagot mo na lahat ng questions nila before you take the consent. 69 is letter C. 70. KP is participating in a cardiac study in which his physician is directly involved. Which statement by KP indicates a lack of understanding about his rights as a research study participant? Okay? Ano ulit na pag-usapan natin kanina? Lahat yan pwede, pero hindi niya dapat papalitan yung physician niya kapag hindi na kinomplete yung study. This is a clear violation of your justice. Okay? 70 is letter D. 71. An immediate objective for nursing care of an overweight, mildly hypertensive client with urethral colic and hematuria is to decrease. Okay? Ang urethral colic, ang meaning lang yan kasi is your abdominal pain. Okay? Ang ating immediate objective pa rin is your pain. Pain is always a priority. 71 is letter C. Diba? Ang meaning kasi ng colic is pain. 71 is letter C. 72. When reading the urinary disease reports, the nurse recognizes this result as abnormal. Ano daw ang abnormal dyan is your letter A or letter B. Pwede siyang maging sagot na dalawa. Normally, dapat wala kang RBC, no RBC in the urine. Tapos ang turbid kasi na urinalysis, diba makikita natin to for patients with infection. So it's either of the two. 72 is letter A and B. Normal na walang glucose dapat. Ang normal pH ng urine is 4.5 to 8. So normal yung dalawa. 72 is letter A and B. Next, 73. Following a renal angiography, the patient assessment priority is the what? Kapag nagre-renal angiography kasi sila, pinapasok nila yung dye using your femoral artery. Ginagamit nila yung femoral artery. Okay? Since femoral artery ang ginagamit nila, we have to watch out for bleeding. Especially artery yung ginamit nila. Diba? That is why, ang isang important assessment priority natin kapag nag-angiography sila is actually your puncture site. Okay? 73 is letter D. 74. Eileen, 45-year-old, is admitted to the hospital with a diagnosis of renal calculi. She is experiencing severe flank pain, nauseated, and with a temperature of 39 degrees Celsius. Given the above assessment data, the most immediate goal of the nurse would be which of the following? Okay? Meron ka na namang renal calculi. Diba? Paulit-ulit yung ating tanong. Kapag meron kang renal calculi, ano ulit ang immediate goal mo or ang immediate intervention mo? It is always to alleviate pain. Basta renal calculi yan, guys, sobrang sakit daw. Kaya usually yan ang ating priority. 74 is letter C. 75. After IVP, a renal stone was confirmed and left nephrectomy was done. Her post-op order includes dairy urine specimen. Sent to the laboratory. Eileen has a Foley catheter attached to a urinary drainage system. How will you collect the urine specimen? Number 75, your answer is letter D. Disconnect the drainage system from the collecting bag and allow the urine to flow from the catheter into the specimen container. Okay? Letter D. 76. Where would the nurse tape Eileen's indwelling catheter in order to reduce urethral irritation? It is in the patient's inner thigh. 76 is letter A. Now, ang difference lang naman kapag sa babae at lalaki, kapag babae, sa inner thigh natin tinatay yung kanilang catheter. Para hindi gumagalaw-galaw yung catheter, pwede kasi siyang mag-cause ng irritation. Sa mga lalaki naman, tinitape natin siya sa lower abdomen kasi 'di ba ang penis natin usually is pa taas. Okay? That is the difference between the female and the male catheterization. 77. Which of the following menu is appropriate for one with low sodium diet? Low sodium ang pinag-uusapan ha? Instant noodles? No. Mataas sa sodium yan. Together with your ham and your canned soup. Ang pwedeng answer dyan is letter C. Okay, white chicken sandwich, vegetable salad, and tea. 78. How will you prevent ascending infection to Eileen who has an indwelling catheter? Dapat, what? See to it that the drainage tube does not touch the level of the urine. The ratio is on the next slide. Okay? Ganito kasi yung urinary bag natin. Ang meaning kasi ng ascending infection is kapag ascending infection from the word itself, ascending from the urinary bag, umakyat yung infection through the tubing papunta dun sa urinary tract ng pasyente. So, paano natin ito mapre-prevent? Dapat hindi nagtatouch yung urine dito sa tubing. Diba? For example, punong-puno yan ng urine. For example, punong-puno yan ng urine. Punong-puno yan ng urine. There is a tendency kasi na mag-backflow ang urine papunta dito, tapos masama ang bacteria, causing your UTI. Okay? Next. An abnormal constituent of urine is what? Anong hindi natin nakikita sa urine na sabi ko kanina is your glucose. Kaya normally, wala dapat glucose sa urine. Kapag nakakakita sa nila ng glucose sa urine, that is called your glycosuria. Glycosuria or glucose in the urine is indicative of diabetes mellitus. 79 is letter B. 80. The normal quantity of water ingested and excreted in the urine is approximately ilan? Dapat meron kang naiinom at naiihi na 1.5 liters per day. Okay? 1.5 liters per day. 80 is letter B. 81. The normal amount of sodium ingested and excreted in the urine is approximately ilan? 6 to 8 grams daily. Kaya dapat tayo, ang ating sodium intake lang is 6 to 8 grams lang din per day. Kasi yan lang ang kayang i-excrete kayang i-excrete ng ating urinary bladder, ang ating urinary tract in a day. 81 is letter C. 82. Increased blood osmolality will result in what? Will result in antidiuretic hormone stimulation. Okay, ano bang nangyayari kapag tumataas ang osmolality? Increased osmolality simply means meron kang increased what? Increased solutes in the body. Diba ang osmolality kung gaano ka-thick yung blood? So, the thicker the blood, the higher the solutes in the body. Kaya ka nagre-release ng antidiuretic hormone kasi diba ang antidiuretic hormone natin holds water. Bakit gusto nating i-hold ang water? Para ma-dilute ang solutes. Pag na-dilute ang solute, bababa na ang osmolality to the normal level. That is your letter A. 82 is letter A. 83. A major sensitive indicator of kidney disease is it's your creatinine clearance level. Kaya kung papipiliin kayo, anong mas maganda nating test for your kidney disease? It's your creatinine compared kay BUN. Mas sensitive kasi si creatinine compared kay BUN for kidney disease. Okay? Kaya kapag tinanong kayo sa board exam kung anong mas magandang gamitin, it's your creatinine clearance test compared kay BUN. 83 is letter B. Anong major manifestation ng uremia? Ano ang uremia ulit? It is the increased waste in the body. Okay? Increased waste of the body. Ang usually dyan na tumataas is your phosphorus. Okay? Waste product kasi ang phosphorus. And usually kapag mataas ang phosphorus, meron silang inverse relationship ni calcium. Kapag mataas ang phosphorus, bumababa ang calcium. So that's your letter C. Hypocalcemia with bone changes. Okay? Ang isa sa mga waste products kasi na nare-retain kapag ang patient may kidney disease is your phosphorus. Hindi nila maiihi ang phosphorus. So kapag tumataas ang phosphorus, bumababa din ang calcium kasi meron silang inverse property. 84 is letter C. Next, significant nursing assessment data relevant to renal function should include information about what? It is your all of the above pa rin. Okay? Nursing assessment data relevant to renal function. Kapag meron kang voiding disorder, meaning meron kang renal dysfunction. Okay? A patient's occupation. Ang mga patient kasi na nag-work sa mga silica gel factory, they are at higher risk or a risk factor yan for renal disease. The presence of hypertension and diabetes mellitus, this causes kasi decreased perfusion to the kidneys. Kaya masisira din ang kidneys. 85 is letter D. Next, oliguria is said to be present when urinary output is, nasabi ko na kanina, less than 100 ml per hour. Per hour ang pinag-uusapan pala. Less than 30 ml per or 30 milliliters per hour. Pag less than 30 ml per hour, considered as oliguria na yan. 86 is letter A. Next, a 24-hour urine collection is scheduled to begin at 8 a.m. The nurse should begin the procedure by how? Dinidiscard muna natin yung unang ihi niya at 8 a.m. Okay? Kailangan mo, for example, 8 a.m., di ba ang schedule niyang 24-hour urine collection? Yung pang 8 a.m. niyang ihi, dapat i-discard muna natin. Kasi hindi siya part ng bilang. Okay? Kasi gusto natin yung ihi niya na from 8 a.m. onwards. Kaya dinidiscard natin yung 8 a.m. specimen niya. 87 is letter A. Next, the nurse should inform a patient that preparation for intravenous urography includes, kapag nag-intravenous urography tayo, ang nangyayari kasi dyan, kailangan natin, may picture ba tayo? Kailangan nating makita kung paano nag-work yung ihi ng pasyente or saan dumadaan yung ihi ng pasyente. Okay? Kapag nag-intravenous urography kasi, maglalagay sila ng dye, tapos dapat paihiin mo yung pasyente. Patient should urinate. Para lang makita natin kung saan dadaan yung dye. Okay? Kung normal pa ba yung structures ng kanyang urinary or urinary tract. That is your letter B. Liquids before the test. Okay, kailangan nating painumin ng madaming tubig yung pasyente kasi during intravenous urography, dapat mapaihi natin yung pasyente. 88 is letter B. Next, 89. Nursing responsibilities after renal angiography include all of the following. It is all of the above pa rin. Assessment of peripheral pulses. Di ba nasabi ko sa inyo kanina, yung dye kasi dinadaan natin sa femoral artery. Dinadaan natin yung dye sa femoral artery. So there is a tendency kasi, 'di ba, ang femoral artery natin supplies the leg. Okay? Kapag na-damage natin si femoral artery, there's a tendency na magkaroon ng decreased perfusion sa paa. Okay, delikado 'yan. Pwedeng mamatay yung paa ng pasyente. Color and temperature comparisons between the involved and uninvolved extremities? Yes. Kasi kapag mas malamig doon sa area ng femoral artery na tinusok natin, meaning decrease din ang perfusion doon. Examination of the puncture site? Yes. Kaya all of the above. 89 is letter D. Okay? 90. A cystoscope allows visualization of the what? From the word itself, cystoscope, it actually visualizes all of the above na naman. The bladder, the ureteral orifice, and then the urethra. Okay, nasabi ko na sa inyo kanina, di ba? Yung cystoscope natin umaabot up till the urethra. Or I mean up till the ureters pala, sorry. 90 is letter D. 91. Nursing management after a renal brush biopsy includes what? Includes, syempre, all of the above pa rin. We have to assess for clinical manifestations of hemorrhage. Ano ulit yung pinag-usapan natin kanina? Almost 25% ng cardiac output pumupunta sa kidneys. Highly vascular kasi ang kidneys natin. Madali siyang magdugo. Kaya we assess for hemorrhage. Positive. Encourage fluid intake of 3 liters every 3 hours. Positive din yan para lang din ma-clear out natin yung kidneys from ma-clear out natin yung kidneys from blood clots. Kasi 'di ba ang biopsy kumukuha tayo ng tissue doon sa kidneys mismo. Obtain a sample of each voided urine to compare it with the pre-biopsy specimen. Yes din. Para lang ma-make sure natin na hindi damage yung kidneys natin after the biopsy. 91 is letter D. Okay? 92. The most accurate indicator of fluid loss or gain in an acutely ill patient is yung kanilang weight. Okay? Yan ang ating best objective sign ng fluid loss or gain. Best indicator of fluid loss or gain. Bakit? 1 liter is equivalent to 1 kilogram of body weight. Number 92 is letter D. The nurse knows that the patient who is retaining fluid had a 1 kilogram weight gain. The nurse knows that this is equivalent to about, di ba nasabi ko sa inyo kanina, 1 kilogram is equal to 1 liter of water. So the answer is letter D. 1000 ml is also 1 liter. 93 is letter D. 94. A patient is admitted with electrolyte imbalance. He has carpopedal spasm, ECG changes, and a positive Kovostek sign. The nurse suspects a deficit of, kanino natin makikita si Kovostek sa trousseau? Kay hypocalcemia. 94 is letter A. Next, the major manifestation of nephrotic syndrome is, anong pinaka-manifestation ni nephrotic syndrome? It's your edema. Ang pinaka-problem naman kasi kay nephrotic syndrome is, yan, ang pinaka-problema natin kay nephrotic syndrome is your proteinuria. Ano ulit ang major protein natin? It is your albumin. Kapag walang albumin, ang purpose ng albumin, it holds water. So kung wala kang albumin, magkakaroon ka ng third spacing or magkakaroon ka ng edema. Okay? It is due to your proteinuria. Next, a clinical diagnosis of nephrotic syndrome is consistent with an exceedingly high level of what? Exceedingly high level of protein in the urine kasi nga meron kang proteinuria. Number 96 is letter C. Next, potassium intake can be restricted by eliminating high potassium foods such as what? Saan natin makikita usually ang mga potassium? Sa citrus fruits. Okay, ganito nyo madaling mamemorize ang mga potassium-rich versus your sodium-rich foods. Mag-drawing lang kayo ng cheese. Okay? Kapag yung fruit or yung vegetable na nakalagay dun sa board exam, makikita natin na hina-harvest sa top ng trees, mataas yan sa potassium. Kapag naman hinukukay sa lupa, mataas yan sa sodium. Example natin, potato. Example natin dito, banana. Okay? So, di ba ang mga citrus fruits natin, hina-harvest siya sa top ng trees? That is why mataas siya sa potassium. 97 is letter B. 98. The leading cause of end-stage renal disease is what? Ano usually ang nagkakos ng end-stage renal disease? It's your diabetes mellitus. Bakit? Sa diabetes mellitus kasi, di ba, nagiging thick yung kanilang blood? Masyadong thick yung kanilang blood, nagdi-decrease ang perfusion sa kanilang kidneys. 98 is letter A. 99. Recent research about the long-term toxicity of aluminum products has led physicians to recommend antacids Antacids that lower serum phosphorus such as what? It's your calcium carbonate. Ano ulit yung sinabi ko sa inyo kanina? Diba? Phosphorus has an inverse property with your calcium. Okay? Dito, diba, sabi natin, antacids that lower serum potassium levels. That's your calcium carbonate. 99 is letter A. Kapag mababa si phosphorus, tumataas si calcium. Pag mataas si calcium, bumababa si phosphorus. 99 is letter A. 100. Dietary intervention for renal deterioration includes limiting the intake of what? Anong pinapababa natin? Ayaw natin ng all of the above. Kasi 'di ba kapag may renal deterioration ka, kapag meron kang acute kidney injury, hindi mo kayang mag-secrete ng waste, hindi mo kayang mag-excrete ng waste products. Kaya all of the above. 100 is letter D. 101. The process that underlies and supports the procedure of hemodialysis is letter C. Ultrafiltration. Ultrafiltration happens in the dialyzer. Okay? It happens in the dialyzer. Anong ginagawa niya? 'Di ba? Para ang dialysis machine natin, it acts as your kidneys. So finifilter niya ang ating blood before returning it to the patient. 101 is letter C. Next, an incomplete protein not recommended for diet of a patient managed by long-term hemodialysis is found in letter C. Ang milk daw natin meron siyang low biologic. Na-explain ko naman na before yung low biologic value protein. Okay? Ang letter A, letter B, at letter D, they are high biologic value protein. Okay? Yan. Number 103. With peritoneal dialysis, urea and creatinine pass through the peritoneum by diffusion and osmosis. Okay? Ano bang nangyayari sa peritoneal dialysis? 'Di ba? Naglalagay tayo ng dialysate doon sa peritoneum ng pasyente. And through osmosis, nagpapalitan sila ng waste products. Okay? Through osmosis, pumapasok ang potassium creatinine papasok doon sa dialysate. Okay? That is your peritoneal dialysis. Next, at the end of 5 peritoneal exchanges, the patient's fluid loss was 500 ml. The loss is equal to approximately ilan? Okay, so 500 ml daw ang water loss. So 500 ml is equivalent to 0.5 kilograms of 0.5 kilograms. Okay, i-transform lang natin si 0.5 kilograms to pounds. In order for us to do that, 0.5 kilograms times, 0.5 kilograms times 2.2 is equal to 1.1 or 1 pound. 104 is letter B. The major danger after renal surgery is hypovolemic shock caused by hemorrhage. Ano na ulit? 25% of cardiac output goes to the kidneys. Kaya kapag nag-undergo sila ng renal surgery, ang pinaka-problem talaga natin is your hemorrhage. Kasi highly vascular ang kidneys. 105 is letter B. 106. The type of incontinence that results from a sudden increase in the intra-abdominal pressure is called your stress incontinence. Okay? Anong nangyayari ba kapag tumataas ang intra-abdominal pressure? Kapag tumataas ang intra-abdominal pressure, anong nangyayari? Naiipit si bladder. Okay? Kaya sila nagiging incontinent. Kasi naiipit yung bladder, kapag nag-i-increase ang intra-abdominal pressure, naiipit yung bladder, naiihi yung pasyente. That is called your stress incontinence. Always remember, ang stress incontinence is due to your increased intra-abdominal pressure. 106 is letter B. Next, incontinence or dyssynergia is avoiding dysfunction found in the following neurogenic disorder. Kanino daw natin makikita ito? Sa what? Kaninong patient? Sa mga patient na may Parkinson's disease. Bakit? Ano bang problema natin kay Parkinson's disease? Meron silang decreased muscle coordination. Okay? Ano ulit ang bladder natin? It is a type of muscle. Okay? Since decreased ang muscle coordination ng Parkinson's disease, decreased din ang kanilang muscle coordination sa kanilang bladder. Okay? That's your Parkinson's disease. 107 is letter D. Next, fluid management as a method of behavioral therapy for incontinence requires a daily liquid intake of ilan lang? It should be 1 liter to, hindi siya ml. 1 liter lang. Okay? Para hindi sila maging incontinent. Okay, nakuha ko lang yan sa libro. Wala na masyadong ratio. 108 is letter B. Next, spastic neurogenic bladder is associated with all of the following except reduced bladder capacity. Kapag reduced kasi ang bladder capacity, makikita natin yan kay urge incontinence. All the rest kay neurogenic bladder na yan. Number 109 is letter D. Next, the major complication of neurogenic bladder is what? Kapag meron ka kasing neurogenic bladder, you can't pee. Kasi hindi niya maramdaman, di ba? Kailangan kasing matrigger yung sacral nerves ninyo para mapaihi kayo. Pero kapag may problems kayo with neurogenic bladder, hindi kayo makaihi kasi hindi gumagana ang inyong neurons. So your answer is letter B, infection pa rin. Because can't pee causes urine stasis. Next, 111. The major cause of death for patients with neurologic impairment of the bladder is your what? It's septicemia. Nasabi na natin kanina, di ba? Neurogenic bladder can cause your infection due to urine stasis. So, ang inyong complication naman or ang major death naman is due to septicemia. Okay, septicemia means systemic infection. Next, nursing measures for the patient with neurogenic bladder include what? Include keeping the patient as mobile as possible. Ano ulit ang problema kay neurogenic bladder? Hindi sila makaihi. So, palakarin natin sila ng palakarin para ma-increase natin ang peristalsis. Makakaihi yung pasyente. 112 is letter B. Next, 13. When managing a closed urinary drainage system, the nurse needs to remember not to do any of the above. Ayaw kasi natin na nagtatouch ang drainage bag sa floor because this can cause your ascending infection. Okay? Ayaw din natin na dinidisconnect yung bag. The moment na dinisconnect mo kasi yung bag, there's a tendency na merong pumasok na infection dun sa bag. Raise the bag above the level of the patient's bladder? No. Dapat nakababa. Lower the drainage bag below the level of the patient's bladder para ma-prevent natin ang backflow ng urine. 13 is letter D. 14. A woman is taught to catheterize herself by inserting the catheter into the urethra by how many inches? 3 inches. Okay? By the book na lang din yan. 3 inches daw. Okay? Next. Patients with urolithiasis need to be encouraged to kailangan ma-encourage natin sila to what? Increase their fluid intake so they can excrete 2,500 ml to 4,000 ml of water every day, which will help prevent additional stone formation. Okay? Tama din sana ang exercises pero hindi naman kailangang strenuous. Supplement their diet with calcium? No. Kasi 'di ba? Ano ang isang component ng ating kidney stones is your calcium. 'Di ba? We have your calcium stones. Do not limit voiding. The more na you limit voiding, the more na magka-clump ang solutes, the more na magkakaroon ka ng kidney stones. Next, a patient being prescribed a diet moderately reduced in calcium and phosphorus should be taught to avoid. Ano ang mataas sa calcium dyan? It's your milk. Okay? 116 is letter B. And then last, number 17. Which of the following solutions will be useful to help control odor in the urine collecting bag after it has been cleared? Anong nilalagay natin? Anong ni-swish around natin doon sa collecting bag? It's your vinegar. Vinegar kasi is a natural odor eliminator. And that ends our genitourinary tract discussion. Congratulations, nurses. I know and I believe na kayang-kaya nyong matapos ang board exams nyo with flying colors. Okay? See you na. See you when I see you. I think I will be seeing you na on the makikita ko na kayo na lang. Magkikita-kita na lang tayo sa kailan? Sa victory party. Yes! Okay. Bye-bye. Thank you so much. Thank you so much for attending this this meeting. Okay, thank you so much. Bye-bye po. Good luck. God bless. Galingan nyo, nurses.